You just have to look at the headlines about the troubles facing Chris Hani Baragwanath Hospital in the past week to know that our healthcare system is under significant pressure, government hospitals in particular. Funding cuts, mismanagement and corruption continue to plague many institutions. At the same time, private healthcare is generally well-resourced and it seems willing to help. Dr Ali Hamdulay is CEO at Metropolitan Health Corporates. He believes more collaboration between the public and private healthcare sectors may help ease some of the burdens. And he joins me now. Doc, thanks so much for your time. So Metropolitan Health Corporates is essentially an administrator of medical aid schemes. You also provide health and wellness services. There is a level of working together already between public and private hospitals. I wonder if you could start by giving us a sense of the level of cooperation that currently exists and where an organisation such as yours enters the debate.
Yes, thank you very much and good evening to all the viewers. Metropolitan Health is one of the largest healthcare administrators in the private sector. So as you said, we administer medical aids and provide wellness and occupational health services to public sector, government agencies, as well as corporate clients. And while COVID has taught us, and our response to the epidemic has really heightened our ability to cooperate with public sector and with government and provincial health departments, we also have various other initiatives that have added value in terms of our ability to service and support public sector healthcare needs. So one such example is CSI initiatives where we've created private-public partnerships, working with non-profit entities such as Gift of the Givers, the Health Foundation, and the Clinton Health Access Initiative. And these are non-profit organizations that are quite close to the details in terms of the support that some of our public sector infrastructure and resource requirements in our country. And in partnership with these non-profit organizations, as well as the provincial health departments, we've sort of identified, some key areas where the investment from the private sector has helped support the provision of access to healthcare in the public sector. One such an example, to make it a bit more practical, is the Dora and Giza Hospital in the Eastern Cape, where we partnered with the Clinton Health Access Initiative and assisted in refurbishment and infrastructure projects to improve the neonatal unit in that hospital. So that's one or two such examples of where we can practically assist public sector in quality healthcare.
Surely, though, that is just a drop in the ocean of need when it comes to what government patients at hospitals require. There is so much that's going wrong. Is a sort of CSI project here and there and a bit of a public-private partnership? I mean, how broad could this get? Could it really become a big underpinning and support system for public health? Or is it really going to play on the sidelines?
Absolutely. I think it's a good litmus test for what can be done into the future. We recognize that in both health sectors, and we don't like differentiating, but I think it helps with the understanding and the comprehension of capabilities. There are certainly centers of excellence in the public sector. You look at the TB and the HIV programs as an example, the antenatal care programs that are run in the public sector. These are well organized, well coordinated. The immunization programs also, quite remarkable when you look across the globe. And these centers of excellence, can be transposed across a greater access across the country. But there are also opportunities for private sector to contribute more meaningfully. So we believe that these initiatives, although we term them as CSI, they are largely private-public partnerships, and they become a good model for the future. I think the success of our healthcare system in the country is mutually beneficial to both, to all members of our communities, if private and public initiatives can really take off the ground. And we believe it's that collaboration that can assist with universal healthcare access and NHI as well. So the private sector sits with a whole host of assets and capabilities and business processes and skills that will contribute towards a more holistic approach to healthcare. And finding ways to explore that partnership is certainly created through a private-public partnership initiative.
So if we look at a massive hospital, a massive government hospital like Chris Hani Baragwanath, two stories that have just come through just in the last week or so. One is that since 2020, there have been 900 neonatal deaths that could have been prevented, not necessarily negligence, but directly related to babies getting too cold in neonatal ICU, infrastructure not supporting, there not being enough equipment. We're also hearing from Chris Hani that there's again a supply chain problem regarding food and essential items needed for those wards. Where would a company such as yours get involved? Could you make that much of a difference in a massive operation like Chris Hani? Would you even want to? Because it surely is a difficult thing to tackle.
I think there's definitely a need, and there's also an intention within the private sector to support and assist. We're not there to circumvent the role of the various departments, provincial department and national departments that have overall accountability for the provision of healthcare. But certainly where the opportunity exists and where the funding can be made available to assist and support in key projects, and especially those projects that are high priority projects. So the partnership with NGOs, as an example, can create a vehicle and a model for that type of support. Chris Hani Baragwanath is one example, but the Charlotte Makeke and the fire that ravaged that unit, and we are aware that there are entities that are assisting and helping in that regard, and that's where private sector can contribute, through a funding mechanism and through resources that can support upliftment of public sector.
So is this a model, and as you say, there is already a lot of private sector assistance going on, and there's a lot of cooperation between private and public health, and as you say, centres of excellence within public health. But do you see this model scaling up to be the precursor really to NHI, or could it be an alternative to NHI? And a lot of people looking at the plans for a national health insurance system are saying there's just no way we could combine public and private and make sure that private healthcare standards stay the same. So is it a precursor to NHI, what you're suggesting, or actually an alternative?
It's probably both. So, I mean, within the current debate and discussions and the dialogue relating to NHI, there's certainly a strong voice for the retention of the private sector and the great work that has happened in that regard. Bear in mind, it takes off the burden of demand on the public sector and really, creates the support from a holistic health perspective. But also within the private sector, I mean, we've been through health funding and health claims management, and the solutioning around preventative care, all these type of elements that has made the private sector the success in certain regards. These assets and these capabilities can certainly help leapfrog, the requirements at a public sector and an NHI level. We heard over this past few days at the Presidential Health Summit at Birchwood Estate, where the advisor to the president, health advisor to the presidency, Dr. Ali Hamdulay, spoke about the collaboration that's required between civil society and the private sector, in areas where government may need that type of support. So there's certainly dialogue and narrative around the role that private sector can play in the roadmap to NHI, and I'm happy to share that I think the various representative entities and the various organizations are part of that dialogue and that conversation. So we render support to that future roadmap that says that within the public sector, within the private sector, there's a great opportunity for these entities to work together through the partnership models and ensure that we use the current assets, we use the current centers of excellence that exist within our health sector at the opportunity to improve healthcare access for all citizens in South Africa.
I mean, it sounds very hopeful and it sounds proactive, and it's what we need to get proper healthcare in this country in many ways. But the one issue that seems to dog the health system and many other government institutions. And let's face it, it's present in the private sector, but it's really something that has become a massive problem during the state capture years, and that is corruption. We know what's, the allegations around Tembisa Hospital, for example. How reluctant might the private sector be to get involved with a hospital if it doesn't have a clean bill of health in terms of corruption?
I think we're in a society now where corruption forms part of the agenda of any dialogue. And, we certainly see elements of fraud, waste, and abuse across the board. And how we respond to that is part of the agenda that will be formalized and formulated, when we have these type of partnerships.
All right, so it's got to be addressed and it's got to be dealt with head on. Thank you so much, Dr. Ali Hamdulay, CEO at Metropolitan Health Corporates, coming up with ideas, ways to deal with South Africa's health emergency and assist government hospitals in distress.